Hi guys, welcome back to another video. My name is Deanna and I'm your SD with the bestie. You guys, today's discussion is one of my favorite pick-me-up treatments. It's understanding chemical peels. I can't wait to share all of the information with you guys, but let me tell you, this is the fastest pick-me-up treatment, in and out, not much downtime. There is some preparation pre and post to prolong your treatment and to prepare for your treatment, but I can't wait to debunk some myths because there's a lot of skepticism with chemical peels about like burning your skin, you know, etc., etc. But let's talk about it because this is done properly. It's one of the best treatments for people who don't have much downtime and who are on the go constantly. So I can't wait to share more information with you guys, but this discussion will be great because it's one of my favorites. And I can't wait to discuss what we have in the treatment, as well what peels are out there for you. So let's get started. Let's talk about the myths. There are so many myths that I hear from my patients and their friends are telling them things. So let's start debunking them and let's talk about it. So chemical peels are unsafe is the first myth I hear. So not true. If you go see a certified dermatologist or a esthetician who has the proper training, go to a consultation. They will give you all the rundown and we will talk about the questions that you should be asking prior to your treatment so you know what you are expecting in your treatment. It should be always a consultation, always a skin analysis to discuss what is right for your skin, budget, what to expect during the treatment, pre or post treatment care. All of those things help you prep for this treatment, and so you are prepared mentally and physically for your chemical peel. Second one, skin will excessively peel post-treatment. Not true. There are different grades of treatments out there, peels out there. Superficial, medium, and doctor dermatologist grade. We don't touch the TCAs, which are the dermatologist grade. Estheticians doing superficial to medium grade. These ones are more of the lower level, but still very effective. And it's, like I said, pick-me-up treatment. It's so nice to get that little glow after, especially coming up to an event. Do it a week before. You will see your skin just glowing. You might see a bit of peeling or flakiness. It's not really peeling like a snake peeling. Just get the proper consultation and they will walk you through it. But make sure to get the proper protocols and understanding so you're not freaking out after you get it done. Superficial to medium grade, as long as you moisturize and hydrate, you may not see the flakiness. Sometimes you might see a little bit of peeling. Don't peel it. It's completely normal, but it's not excessively peeling. The third one, chemical peels can't be used on sensitive skin. Not true. Rosacea is one of the top most sensitive skin out there, and there are chemical peels that can help better rosacea and sensitivity. Peels are to help build integrity in the skin, and this is one of the great first treatments you can get. Make sure you do the proper consult as well. The fourth one, there's one type of chemical peel. There are several types of chemical peels out there, so we will discuss them in this video. The fifth one, I only need one peel. I mean, if you want to just see what's going on, but as our skin ages, we definitely need to do more treatments and maintenance treatments in the clinic in order to see long-lasting results and beautiful results. But we will discuss this further in this video. I hope this discusses all of the myths and debunk them all and understand a little bit more. but let's get to what is a chemical peel. A chemical peel is a clinical form of exfoliation done by either like a certified esthetician or a dermatologist, depending on what you're wanting to target, using acids like AHA, alpha hydroxy acid, or BHA, beta hydroxy acid. We'll talk about more of these acids a little bit later on in the video. However, this is a really good exfoliation for the skin to remove the damaged layer of epidermis, which is the outer layer of the skin. Using naturally sourced fruits and enzymes typically, or milk, it's really great to help promote cellular renewal for collagen production. Also helps target acne, wrinkles, fine lines, texture, pigmentation, scarring, and to build skin integrity for a more healthy and youthful complexion. We are going to talk about AHAs and BHAs, the different forms of peels. I'm going to speak mostly about the esthetician ones that we can provide here in the clinic. And most of them are in AHA and BHA, which is, in the AHAs, there's several ones: glycolic, mandelic, malic, and lactic. Those are the 4 that we typically see in the clinic. And the BHA, which is salicylic. Before we begin talking about the different forms of AHAs and BHAs and chemical peels out there, let's talk about molecule size. This is so important, especially even in your skincare routine, because we want to understand how deep it penetrates into your skin layer. So you want something in your skincare home care routine to penetrate deep into the dermis layer. So the smaller the molecule, the deeper it penetrates. The larger the molecule, the less it penetrates. This is important to understand, and this is why we always tell people to use a medical grade to prolong your service and treatments. Also, to target what you want to target or prevent any of those skin concerns that you don't want, like pigmentation, wrinkles, and fine lines. That is so important to understand. So when it comes to chemical peels, if someone were to be more reactive, such as acne or rosacea, you want something less penetrating but targets that outside layer in order for it to target those bacteria, those mites. Those are what starts the rosacea and acne. So a larger form of molecules is what we want for a exfoliation in the chemical peel. For somebody who is more reactive, wrinkles and fine lines or pigmentation, that you want to target deep into the skin, so a smaller form of molecule. So we'll talk about that more in the AHAs. Glycolic acid. Glycolic acid is one of the smallest forms of AHA, which penetrates really deep, gets that collagen stimulating, gets that cellular renewal for more youthful complexion, a smoother complexion. It fades dark circles. It helps with elasticity. This is the form that you want if somebody who is wanting anti-aging. So the second ingredient you can find in an AHA chemical peel will be mandelic acid. It's one of the largest AHA molecules, so it's really great for sensitive skin to treat acne because it has anti-inflammatory and antibacterial properties. It's also really great for sun-damaged skin or to fade pigmentation and promote cellular turnover. So this is really great for people who have more reactive skin. If you find that people who have dry rosacea, this is also a really great peel for them. The next ingredient I want to talk about in an AHA chemical peel is malic acid. This has a larger molecule than the glycolic and lactic acid, which means it doesn't penetrate as deep as the two. This is a really good peel for somebody who has more dehydrated skin or uneven complexion. This is great for a light exfoliation, for cellular turnover, or collagen production. It's also a humectant, which means it retains and attracts water and moisture in your skin better. It's also really great for brightening anybody who wants a more even complexion. And if you guys do have rosacea or sensitive skin, this can be for you. It just depends on what grade of rosacea and sensitivity you have. Because it is one of the larger molecules, it's not as large as mandelic, so it doesn't penetrate as deep as glycolic and lactic, but it still does the work, and just gotta be more cautious because it does cause a little bit of irritation. Next ingredient is lactic acid, which is a type of AHA chemical peel. Also, it is a larger molecule size than glycolic, but smaller than malic acid, so which means it penetrates deeper than malic, but it doesn't penetrate as deep as glycolic. This is a great peel for someone who is dehydrated, if they want to improve their skin's natural barrier. Also, if you have textured skin and you want to improve that, this is a really good peel for you too. It's a type of humectant, which means it retains and attracts water molecules and locks in moisture in the skin. Our last peel I want to talk about is the salicylic acid, which is a beta-hydroxy acid and it's self-neutralizing. It has a larger molecule than the AHA and it's oil soluble. It focuses on the surface of the skin to help unclog the pores, so it reduces the pore size, it helps with inflammation, any breakouts. It's really great to target and regulate oil sebum and acne skin type. So if you have acne, this is the one you want to look for. When your esthetician is talking about imbalance in pH level, this is also going to help you understand why we use a chemical peel in the clinic room. Usually when we're measuring acidity level, it's a scale from 0 to 14, and a healthy looking skin acid mantle has an acidity level of 4.5 to 5.5. Anything lower than that will be too acidic, and anything higher than that is too alkaline. And if it's too much of either side, it means you have an imbalance in pH level. So when we're using chemical peels, depending on which acid you're using, they have different levels of acidity. So the lower the acidity, the more it penetrates, which is also talking about glycolic being the lowest pH level. So it's the most acidic, smallest molecule, and it penetrates and exfoliates deeper into the skin. So something like salicylic will have a higher pH level, still lower than 4.5. And we want to lower the acidity level in our skin in order to break the bond of the dead skin cells. So that is how it's working for cellular turnover and a deeper clinical exfoliation to help for brighter complexion, even texture, and more youthful skin. When getting a chemical peel, you want to make sure you get an initial consultation. Every treatment should start with a consultation because it's so important to go down your medical history, all the medications you're getting, any treatments you have done prior that is contraindicating to a chemical peel, such as Botox, injections, any of those. You want to make sure you wait 3 weeks prior to your chemical peel because you don't want to be moving all those things around, especially when you pay so much money for enhancing your skin, enhancing your features, right? So in an initial consultation, you should be talking about your medical history. Anything that is photosensitizing, we have to stay away from that for at least a month. And depending on what it is, Accutane, such as 9 months after Accutane, because that can cause so much more damage to your skin, such as the sun damage, more pigmentation arising, more sensitivity, and could cause irritations on your skin when using a chemical peel. So it's so important to do a good consultation. You also need a lot of preparation to your chemical peels. So if you are not using any active ingredients, you want to start using it at least 2 to 3 weeks prior to your chemical peel, such as salicylic, so BHAs and AHAs. You want to start using them 2 to 3 times a week starting for preparation because it's building integrity to your skin. So when we expose it to such acidity levels, your skin is not so agitated. But you want to stop using active ingredients for at least 3 to 7 days prior to your chemical peel, depending on the level of peel you're getting. This is why an initial consultation is so important, to be able to get the full rundown as to what to expect, preparations in your skincare routine, preparations post skincare routine. So you want to also stop any actives post treatment after your chemical peel. You want to stay away from excess sweating for the first 24 to 48 hours. You want to stop using anything that agitates your skin. Everything is gentle. Gentle cleanser, moisturize, always hydrate. Don't peel at your skin. Just let it naturally slough off because you're going to cause pigmentation and scarring if you do peel. You want to make sure to use sunscreen as well. Every treatment is always recommended to use sunscreen and try to reapply. Otherwise, wear a hat. Making sure to wear a hat and stay away from the sun for at least 7 days so you don't have any more pigmentation in your skin if that is what you're treating. Also, who wants pigmentation anyway? So wear your sunscreen. In the clinic, we use Lymed products. They use the 4-step rule of skincare routine, which is cleanse, treat, balance, and protect. This is the 4-step rule that we like to tell people about, especially for preparing for their treatments and for post-care. In the clinic, we also use their 3 peels, which is the Oxygen Regenerative Peel. This one's really great for breathing life back into your skin. Your skin's feeling dull, needs a little pick-me-up, but you don't know where to start. This one's a great, gentler exfoliation and more milder form of peels. This one I like to start people off with. The second one is our Peptide Perfector Peel, which is our youthful fountain peel. This one is great for just before events. 3 days prior to events, you are glowing, you are stunning. It uses 3 different AHA peels, the lactic, mandelic, and malic acid to help exfoliate and promote cellular turnover and collagen production. Then the third peel is the 30% lactic acid. This one's more of our aggressive form of peels. It's typically done after 2 to 3 times of our initial peels, which was the oxygen and the peptide peel. So if you guys are looking for something that is helping to repair and improve your skin's natural barrier, or if you need more hydration and locking moisture into your skin, the 30% lactic peel is for you after doing the initial 2 peels to prep your skin and build integrity into your skin. If you guys have more questions about this, please comment below or email me. If you guys need a initial consult for any peels, definitely DM me as well. We can get you in for that. But thank you so much for watching, and I can't wait to see you guys in the next video. Bye!